The U.S. Bureau of Labor Statistics says the Michigan unemployment rate in October 2007 was 7.7%, the highest in the nation, 3% above the national average. Employment fell by 43,000 and unemployment advanced by 9,000 as the state's labor force declined by 34,000 over the month. Public health and sociology professor Sarah Burgard, who's affiliated with the U of M Institute for Social Research, studies the particular problems job loss creates for so-called non-standard workers. She says our current system of workers' compensation, health insurance, and retraining programs is structured to benefit the traditional worker, but non-standard workers are falling through the cracks.
Standard or traditional jobs in the United States really arose in the post-war era when we had a lot of economic growth and a lot of promising trends in the economy. A standard job at that time was a full-time job, and you expected to stay with that employer until retirement when you got your gold watch at the end. It included benefits like health care insurance coverage, unemployment insurance, and pension benefits at the end of the day. We're talking today about non-standard work, which includes many part-time jobs, contract work, temporary help agency employment, and self-employment. Non-standard workers don't have the same kinds of benefit coverage. Unemployment insurance was structured to be connected to full-time work in standard jobs. That means that today, if you're in a part-time job, or if you haven't been working for an employer for very long, you're not even eligible for unemployment insurance, which will make it more difficult for you to find your way back into a good job and to pay your bills in the interim. The other really important feature is that health care insurance in the United States is strongly tied to your employer. And so employer-sponsored health care is actually vanishing for many workers in standard jobs, but particularly for workers in non-standard jobs who are usually not even eligible. The way I would split it up is to talk about voluntary versus involuntary non-standard workers. Some people are working part-time because that's the only job they can get, but they'd prefer a standard type job with benefits, full-time hours, and pay. For those workers, it benefits the employer to not have to pay for benefits and to pay lower wages, and it hurts the employee and might be dangerous for their health in the long term. However, on the other hand, the workplace has changed. And so some families actually prefer to maybe have one worker who has a more flexible schedule so that they can manage those work-life responsibilities. It's also true that many people transitioning to retirement would prefer to work part-time, or people who have some kind of disability that makes a full-time schedule difficult. And in those cases, non-standard employment could be much more beneficial than no employment at all. We need to find a better match for these workers, make standard jobs available for those who need them, and make better flexible employment forms. What I think is important is for policymakers to be aware that the social safety net is based on an old model of employment that doesn't hold anymore, and that non-standard workers are at much greater risk of falling through the cracks.
Among Professor Burgard's research activities is looking at the impact of perceived job insecurity and actual involuntary job loss on a variety of health outcomes among U.S. adults. I'm Laura Bailey at the University of Michigan News Service.